Well, welcome everybody to the November online edition of our program for the alumni of the Sunshine Coast Health Center up here in beautiful Powell River, BC. And this month, we're going to talk about a very strange thing. And the strange thing is time. Believe it or not, there are a lot of people actually in the addiction field trying to figure out how time links with addiction and how time links with recovery. Okay, well, let me try to explain this to you. If you remember your time at Sunshine Coast, you probably remember how difficult it was to get everybody in the same room at the same time. Okay? And usually, well, depending on when you went here, in the old days, they probably threatened you, right? Like, you show up or we're going to kick you out or something like that. Now, in the new way of doing things here, we don't do that anymore. But it's a real tough one to try to convince everybody, like, to actually show up for the programming. Now, traditionally, psychologists would blame this on something like, well, addicts live chaotic lives. And there's a long history to this. I mean, addiction counselors, every addiction counselor who's ever worked in the field knows that addicts are late for appointments or they miss appointments and then you go talk to them like, oh, I forgot, or it's like they are not really paying attention to a lot of things in time, right? And so this traditional idea that addicts just live chaotic lives, they're not really paying attention to stuff, and therefore the treatment, a big part of the treatment will consist of giving them structure in their lives, because they need structure, right? This is the concept. So we'll give them a very structured program with very few options, and then ask them to show up, and this way they will learn to put structure in their lives. Personally, I'm not so sure about that. I mean, it seems to me that if you're an addict, you live a pretty structured life. In fact, so structured that even Narcotics Anonymous calls the addict's life meaningless and monotonous and boring. But so structured, you wake up in the morning, right? Oh, geez, I got X number of hours until I get dope sick, right? So I got to put all this stuff in place. But anyway, the traditional thinking is that addicts live chaotic lives and therefore need structure. So that's how they interpret this whole time thing. But a lot of people are wondering about it, and they're asking, well, is that true? In fact, I've got in my hand a research document from last year. This is out of England, and this guy he's done some really interesting stuff. His name's Ryan Kemp. He works for the National Health Service in England, and he's looking at how addicts interpret time, right, and what they will need for recovery. And his big point is that addicts live right now, in the present. In fact, the future and the past have very little meaning for them. And if you think about it, this makes a lot of sense. Like, why would the past have any real meaning for someone in active addiction? Like, what's the past going to do for them? Nothing. No, they need to get the money and they need to get the dope now. Similarly, in the present or in the future, what's the future going to do for an addict? What, I'm supposed to wait around twiddling my thumbs for like a next week or two so I can get my drugs? No, of course not. It's not going to work. In fact, most addicts will talk about this waiting to get drugs is almost like, well, the guys around here talk about it as like a feeling of void or a vacuum or a hollowness or something like that. And it's unacceptable and unendurable, and I need the drugs right now, right? Now, mainstream psychologists would call this impulsiveness, things like that. But it may be more, at least according to this article, about how an addict interprets time. And this Ryan Kemp fellow is saying that it's like the present is the only reality for the addict, because the past is really not anything to think about. In fact, the past can be a source of guilt. Oh, geez, I remember, oh man, I should never have done that last night. You know, so that even makes it worse. And the future is no good, because what's the future going to do for you, right? That means you're going to be waiting around, all that kind of thing. So you live right now in the present. So his argument is the reason, if you want to understand why an addict is late or why it's like herding cats, it's because of the way they are interpreting time. The only important thing for the addict is right now. And if it's not happening now, then there's no real point to it. So to say, well, you got to show up at 1 o'clock this afternoon for an appointment with the psychiatrist, it's not a huge thing, right? Because it's not right now. At any rate, we'll be back next week and give you a little more understanding of this idea of addiction and time, and maybe what you're going to have to do in recovery. See you then.